Welcome. Today we're talking with a very special guest. It's Naturopathic Doctor, chiropractor, psychologist, developer of the matrix reflex testing method, and author of several books, including this very large textbook, The Radical Medicine. Dr. Louisa Williams, it's an honor to have you here today to chat with you.
Well, thank you, Christina. Thanks for asking me. It's an honor to be asked.
Good. Yeah. I always love chatting with you. So it's always a wonderful conversation.
Too.
So as I talk with folks who are interested in living a clean and healthy lifestyle, I find there's still a lot of confusion when it comes to alternative medicine and physicians. What's the differences and how that works? So can you tell us a little bit about the key differences between a naturopathic doctor versus an allopathic doctor?
Right. Well, it's a good question because since I've moved back to Texas, not many people know what a naturopathic doctor is versus when I was in Washington, Oregon, California. It's a little more mainstream there. But we're very similar and very different. The similarities are we all go to college and major in pre-med. All graduate, after 4 years. Then we all go to either medical school or naturopathic medical school. Again, 4 years. And then when we graduate, we take national boards approved by the U.S. Board of Education. And then we try to decide which states we're going to practice in for the rest of our lives and take those boards. That's not an easy decision. And we take those state boards and get licensed for the state or states we're going to practice in at that time. So we both graduate from that 4-year medical school as GPs, general practitioners. We both graduate from that. Now, of course, as you know, medical doctors often go on to become gynecologists, dermatologists, neurologists, and they have specialized training after that. MDs do have some internships and some residential opportunities, but not that often. Most naturopaths graduate as a general practitioner after 4 years, and then go to seminars or training, specialized training seminars and courses in their particular area. Like for me, two of my specialties are dentistry and homeopathy. So dentistry, pre and post mercury amalgam detox, pre and post cavitation surgery, if that's required, if you have to pull a tooth. At least I'm not a dentist, but at least acknowledging and being able to tell patients with major malocclusions versus minor malocclusions, which ones need to be referred to do the whole appliance protocol. And then homeopathy, I've taken thousands and thousands of courses and training and, postgraduate courses in homeopathy. So that's what we do after graduation most of the time. Now, the differences are big because medical doctors in America and throughout the world now have lost some of their roots, and they have become very allopathic. As you said, allopathic means against the disease. So if a patient comes in with sinusitis, they're more likely to prescribe antihistamines for hay fever, allergies, sinus problems, etc., antihistamines. If somebody comes in with a rash or eczema, the dermatologist is more likely to prescribe cortisone cream, those kind of things. And that's what it means, allopathic, against the disease. And that is suppression, a very dirty word. Suppression is the worst. As we know in childhood, psychological suppression from very strict parents or some kind of traumatic upbringing is terrible for the child. So is physical too. Suppressing these symptoms and driving the disease in deeper is what we say in homeopathy. So the opposite is to try to figure out what's going on with the patient. And all doctors need to keep in mind the Latin root of diagnosis. Dia means through or see through, and gnosis is actually deep knowing, actually spiritually deeply knowing something. So what a diagnosis should be is when you take a history, an exam, and look at appropriate blood test, do necessary imaging, x-ray, CT scan, whatever is necessary. You take all that information, you see through that jungle of information to what you believe is the true root cause, what the true problem is. Of course, that's hard to do in one visit. We call that first a working diagnosis. And then over time, you learn more and, fine tune it and figure out where that patient needs to put his or her time or money.
And I found that to be the biggest difference, at least from my experience, is that root cause, that we're not treating symptoms. We're not just trying to cover things up. We want to know what caused this issue. Where did it come from, and how do we resolve it ultimately?
Yeah. So a patient with allergies and sinusitis might come in and see me and, go through all that material and go, okay, it's a, chronic sinusitis secondary to a dairy allergy, something like that. And then you point them to the elimination challenge test. You see if they get better avoiding dairy for 2 weeks. And if they do, then they have to do what we call VNR, variety and rotation, cut down a lot on the dairy, have it a little bit here and there, but not the same cream in your coffee every single morning if you have a dairy allergy. It's just, you'll just never get well if you continue to eat that, eat your primary allergen. So I want to say, we know, from ER and all the TV shows, the emergency rooms are very valuable. If I fracture a bone, please give me pain meds, right? And then set that arm or set that leg. But chronically, it's very bad to suppress the pain for years and years and years, or suppress the rash, or suppress the discharge before you figure out what is going on. It's relief, but it's, later on, often more serious disease comes about because of that suppression.
Yeah, and we see that once the symptoms, if one symptom subsides, maybe for medication, another one will start in because the body is still saying it's not resolved. We still have an issue there.
It's not resolved, and then you go even to deeper tissues, and it can get even more serious. So, and that's why in America, there's 50% of Americans, adults and children, live with chronic disease now. I mean, this, real research statistics from universities. So it's unbelievable that the norm is, I have symptoms, I have problems.
It is, yeah. And it seems as though those short visits to the doctor, even if it is preventative, it's not really getting us to where we need to be as a healthy individual. So there's just much more with a naturopath that delving into those issues. That's a huge part.
Absolutely, yeah.
Well, good. Another question that we have is, nutrition is a critical component of the healthy lifestyle, yet everywhere we turn, we see diet books, we see ads, we see each one claiming they're the best. So what do you recommend to folks who are struggling to find the optimal diet for a lifestyle diet, not just a temporary weight loss or something in between, but a real good diet for a life?
Right. Well, I mean, that's true, because there are just a million diets out there, and, politics and religion and diet, you can get very heated when you start talking, vegans talking to carnivores and all that. Mainly, I just say, listen to your body. We are blessed, Christina, being sensitive. So, it's a blessing and a curse. We have more symptoms at times, but it's clear if we eat something wrong over and over again, we know something's wrong. Some people don't feel it as much and don't know what to do. But the biggest thing is to listen to your body and how you feel. If you have more energy, if you feel better after you eat. I have been, studying diet and nutrition. Of course, we get that in our naturopathic college, which medical schools don't get that, for, almost 40 years now. And I have found the Weston A. Price diet is the best diet that I have seen. And what it is, it's a high fat, moderate protein, and what we say is carefully prepared carbohydrates. We don't throw out the carbohydrates completely. We carefully prepare them. We soak them, or do certain things to them to make them more digestible. Sourdough bread versus regular bread. So the whole thing with the Weston A. Price diet, which I know you know, but Dr. Weston A. Price was a holistic dentist in Cleveland. And in the 1920s, 1930s, he was getting freaked out because he saw so many crowded teeth that needed braces. He was having to pull wisdom teeth. Mm-hmm. Our grandparents, our great-grandparents, our great-great-grandparents, they had more room for all 32 teeth, not us with that diminished nutrition in the 20th century, 21st century. So he and his wife in the 1930s went around to indigenous cultures every year for 10 years, New Zealand Maoris, Peruvian Indians, Alaskan Eskimos, Swiss villagers, people that weren't going to the local store and buying white bread and white sugar. And he went for the purpose of finding a healthy vegetarian peoples, and he failed. Yeah.
Interesting.
None of them, all 14 civilizations that he carefully studied, they all ate meat, in all parts of meat, the fat, especially the organs that are so nutrient dense and vitamins and minerals, etc. And he found that these people had no cavities, or 0.1%, and all 32 teeth. And some of them didn't even have names for anxiety or depression in their culture. So it was huge. And that's why we call our foundation the Weston A. Price Foundation, and our diet the Wise Traditions Diet. Now, a lot of those people did have dairy in their, in their diet. Unfortunately, nowadays, with our history of toxic foods as children and toxic drugs and all that, a lot of us are allergic to dairy, gluten, corn, eggs, etc., in varying degrees. So it's very important that you identify through the Elimination Challenge diet. Doesn't cost a thing. You just avoid it for 2 weeks. Your primary allergen, and then watch that one. And then, the rest of the diet is absolutely fine. A lot of variety with meat, elk and venison and beef and chicken and turkey and sardines and all of that, bone broths, meat broths, soups. Again, you're getting all the minerals from the bones, you're getting the fat, you're getting all the nutrients. On my handout, the Toxic Triad of the 20th Century, I say, throw out your boneless, skinless chicken breast. And that always freaks people out. You go to a little fancy restaurant, right? A bed of greens and then chicken on top. These traditional peoples realize that without the fat and the vitamin A and D and K2, and without the minerals, the muscle meat was very difficult to digest. So you want all parts of the meat, as our ancestors did for years, and have done.
That's true. Yeah, we look back at my grandmother, who was a farmer, and her recipes, and she had those indigenous recipes where everything from a chicken went into the chicken noodle soup. Everything was used from the animals because they raised the animals, and it was such a different cookbook than what we're used to. And
love that. And what was her ancestry?
They are Northern European, German mostly.
Okay. It's so cool because the Wise Traditions book that Sally Fallon wrote, Nourishing Traditions, Mongolia, Europe, Africa, Canada, Alaska, every tradition is revered and appreciated. I mean, you meet a grandmother nowadays and she starts talking about recipes or something like that, somebody that is older, and they're very valuable. Because you want to hear how they cooked and what they used.
Yeah, that is quite different. And coming off the farm, everything was fresh. So nothing, everything was cut right, corn off the cob. It wasn't, this many cups of corn. It was like this many ears of corn. It was such a different, so converting for us is, it's interesting, but beautiful recipes. So
valuable.
Yeah, it's so different from what we're seeing now. Of course, the cookbooks, it's, 3 chicken breasts or whatever it happens to be, and dried herbs, and,
Right. Yeah, it's a different world, and that's what we're all trying to do, is cook like our grandmothers cooked, forget the protein powders and the protein bars, just what your grandmother would have eaten. She wouldn't have eaten protein powder shakes.
Right, exactly. Yeah. Yeah, that is a big part, I think, of the diets where people are missing. They're following folks who are really into fitness. They're really into, especially the smoothies with the protein powders, the shakes, things like that. And I think people get a little bit misled because they just assume, since they're into fitness, they have the best handle on nutrition, and that's not always the case.
Oh, and they look so good. They look so perfect. And believe me, I not only, clinically on myself and on patients test these things out, but energetically with my energetic testing, I test these out. And I have never found a protein powder that tested well. I mean, I wanted to sometimes if somebody's in dire straits and needs a liquid diet and is really sick, but there just isn't one. You just want to do a bone broth or a soup or something like that, chicken soup or whatever, for health. These manufactured products, you got to realize, even though they come in all these shiny packages, think about how they were made. They were crushed and pressed and heated, and all kinds of denaturing that's happening in, modern industrial groceries and kitchens and manufacturing plants.
Yes. And actually, while we were at the Wise Tradition conference, I laughed a little because we had a short conversation during that time. About 3 people came up to you asking, how does this product test? How does this product test? And your answer each time was probably not well.
Oh, it's so embarrassing. You have to watch it at conferences because you don't want to hurt anybody's feelings, because the vendors, including me, we've, done a lot, but so little tests. So getting to the diet and going to supplements, you really don't need to take many supplements if you work hard on a clean, organic diet, a nutrient-dense diet.
Yeah. And it seems harder as we keep going. The nutrients seem to be going down in food, but it is still critical that we're paying attention to all those nutrient-dense foods.
Doing the best we can. Yeah.
So I know as a physician, you strive to find the cleanest options available in every area, from home products to supplements. So what advice do you have for those of us wading through the sea of health marketing product claims?
Like for supplements and vitamins and
it could be supplements. Yeah, I know that we all keep seeing these ads. So for example, coffee, there's the big new coffee that's low in acid. It's, all these different things. And I know I try all these different clean, healthy options, and I'm finding very few are living up to their hype.
Very few. And again, notice how you feel after you drink coffee. Sadly, I don't really find any coffee that's okay, so coffee's not okay. Sometimes like a black tea or a green tea can be okay. But it's very few and far between. As far as supplements, and now let me say, when somebody's exhausted, my chief complaint used to be fatigue too. So if you're on the couch most of the day, drink the coffee, drink the black tea. We got to function. But over time, as you get at a higher and higher level, a lot of those things will fade away. You just won't want them anymore. But in regard to supplements, you just don't, you want Cadillac supplements. You don't want a Carvair or an old jalopy supplement. I have patients, they'll go to Target and get their supplements, or they'll go to Costco and get their supplements, and they're not okay. There's research that shows that you can't trust what's in those supplements. A lot of times they'll have, soy in them, or they don't have what they say they're going to have in them. And even health food stores, Whole Foods, there are very few supplements that I can suggest there. Now, again, when you're in bad shape and, when we have a lot of symptoms, sometimes we do need to take this or that just to, some B12, just to have enough energy to function. But otherwise, really what I stock is like natural supplements, like cod liver oil and enzymes from 2 countries in Europe, grass-fed beef and pork, and the ketone minerals from Spain and France, just seawater that's been filtered. So all of those things test well for me. They hold up over time. But the biggest thing, Christina, if people listening today, if they don't know the word excipients, excipient is an important word. It means when you're looking at a label, you're seeing vitamin C, 2,000 milligrams, vitamin A, 25,000 IU, blah, blah, blah. You're looking at that label. At the bottom of the label, it's going to say other ingredients. Now, those are the excipients. So when these manufacturing companies bottle or encapsulate or make into tablets, whatever, tabletize, make into tablets, those words, they have to use fats and lubricants to make the process faster. So there's some horrible excipients out there. There's magnesium stearate, that's a toxic fat. There's calcium stearate, even worse than magnesium stearate. Calcium stearate is in most of standard process, sadly. Yeah, it's not okay. Doesn't test well for me. Haven't for years, even though I repped them 40 years ago. But and then there's methylparaben. Methylparaben's also in our deodorants and our creams. They're taking it out more and more, but they have literally found methylparaben in breast tissue, in cancerous breast tissue. So it's so clear, it is so clearly carcinogenic, but they'll add that. Again, these are fillers, lubricants, so the machines work faster so they can make their products. So check out the excipients, and some companies like Thorne or Professional Formulas, et cetera, they're really clean, and you won't find many excipients in there, or any, maybe silicon dioxide or something like that. You have to have a little bit of filler, but not toxic fillers. So that's the biggest thing. And you will not be able to go to Target hardly Target or Walgreens or Costco and not find a lot of excipients. Now, I was just thinking about fish oils. Fish oils often look good, but again, how did they produce that fish oil? They heated it. It usually doesn't have enough vitamin A or D in it, and they have to add it in. So that's synthetic vitamin A and D made from a pharmaceutical company somewhere, added into the fish oil. So for 20 something years now, I have found that green pasture continues to test as the best fish oil. And then the emu oil, which is the vitamin K2 from Australia, the Walkabout emu oil is excellent. And again, those of you who do muscle testing, that it's a big test. It's the acid test, because you're testing, your muscle testing, or you're doing the MRT test all the time. And as soon as something doesn't test well, it's gone. But so when I say things hold up over time, it means for years now, I've been testing them on patients, testing them on me, and both clinically, see how they feel, see if they do better, and energetically. And, you'll go to a conference and we all do this, oh, let me get this and let me get this. And so many times you waste so much money. You come home, and even with that initial enthusiasm, your testing showed maybe that it was okay, and then it doesn't hold up and it sits on your shelf. So all the products I have, almost all of them, just have been there a long time, and they continue to test well. So anyway, watch the excipients and watch buying supplements. Put your money in diet if you can.
Yeah, definitely. Yeah, and your MRT testing, I've taken your course, and that's been a huge help, at least initially, to understand as I'm standing in the store. If it's not testing well there, I know for sure it's not going to work well. But even sometimes I bring it home and I'm like, no, it's not right.
Right. Oh, Christina, I'm so glad to hear that, because I don't always get feedback, and I'm so glad you're using it, because it's so easy. Yes, no. It's so easy to use mechanically. It's such an easy thing, and it's great at the store because nobody even looks at each other anymore, so you can be sitting there with the ketchup bottle and see which one tests better. And also priority, you can see which olive oil tests best, or which coconut oil tests best, or which, whatever tests the best.
Yeah.
Onions, A red, white, yellow onion, which I was just at Natural Grocers today. Which one is testing best? The red one. The red one often tests best, but not always. So,
Huh. Yeah. And sometimes now when I pick them up, I just know I feel like, nope, nope, don't even have to. This
and
goes back.
that's the beautiful thing there, is that it actually doesn't take away from your intuition. It actually feeds your intuition, your gnosis, your understanding. So you get more and more intuitive, and you need the technique less, because you're like, I'm feeling that one, and that's the one that tests well. But it's good to have that, mechanical test just to back you up when you're not right on every day in your understanding and psychic ability.
Yes. If we only had more of that, it'd be so helpful.
Well, you're working on it. Yeah.
Yes. Yeah, definitely. Yes. It's all of those things really help out to understand and yeah, wade through all these products, because it's quite the market out there. And I like trying new things just to see, because I do like coffee, but it doesn't agree with me. And you're right, I haven't found anything that's been okay. Even the health ones, even the others that claim they're all right.
I know. And some of them have herbs in them. Forgetting some of the names of them, but those herbs don't test well either. Herbs are strong, so they're not easy to digest either. So yeah, it's a shame. I usually it's, once in a while have a cup of coffee with sugar and cream, for a big treat. It's easier to do that than it is that daily dosing. They use coffee in laboratories to test the cytochrome P450 and the detoxification pathways of the liver. They use coffee as one of the challenges to that. So,
okay.
Yeah. You understand how toxic it can be over time.
Right. Yeah. Yeah. But maybe a good detox every so often to kind of flush things out is.
Yeah. Yeah. Are you talking about coffee enemas?
That could be. Yeah. I know that there's a big thing with people really enjoying the coffee. I don't know, enjoying is the right word, but really getting into them. That has been a big push.
No, it is the right word. People really get into it. That is a long story. And I will just say that if you have cancer and if you're under the care of a good holistic practitioner, coffee enemas, saunas, tons of enzymes every day can get you through that. It's fantastic. But long-term coffee enemas, I have found, are a problem. They're a stress to the liver. The liver's going to detox gallbladder bile. You have a bowel movement, and it helps. It helps detox the liver and gallbladder. Over time, though, for example, in Chinese medicine, that liver is going to get more and more inflamed when you do it every day, especially when you don't need to do it every day. You just continue to do it. And what that does in Chinese medicine is they talk about liver fire rising. Fire rises, heat rises. That's natural. Well, it affects the heart and causes heart palpitations. It affects the brain and causes thinking and insomnia at 3 a.m. So I have found people get injured if they keep doing coffee enemas on a daily basis for a long, long time. It's a little dangerous, I think. I think it's too hard on the liver.
Yeah. I think that goes for a lot of the detox. Anything that detox, I've found too, every few months, 6 months, maybe it's nice to clean things out, but otherwise it's just a little too toxic or a little too taxing on the system.
Too taxing, right? Exactly. Yeah.
Yeah. Well, it's been really wonderful chatting with you today, and this is a lot of great information. If folks want to learn more about the services you offer, the supplements, you have a really wonderful website with a lot of great supplements and a lot of great products on it. How can they find you?
Just go to Louisa Williams, ND, Naturopathic Doctor, LouisaWilliamsND.com. And I've got a ton of articles in the blog, where you can find the elimination challenge or information on homeopathy, information on dentistry, all kinds, and the toxic triad of the 20th century, refined flour, sugar, and oils, information on diet. And then, I have products and all kinds of things in there. So, and books. So, yeah.
Yeah, it's wonderful. Yeah. And you always have new books and interesting new things coming out. So it's really wonderful. I check back with your site often because we never know what we're going to find. It's always been wonderful.
Well, thank you, Christina. Thank you so much for asking me.
Yeah. Well, thank you for joining us.
I really enjoyed it, and I will see you later.
Yeah, you take care.
Thanks. Bye-bye.
Bye-bye.